this talk is a talk that I've given before in a couple settings. And, people always ask, like, why are you giving a talk like this, right? And I think that you guys are getting a lot of great input and advice from Charlie and Rod and all the great spine surgeons that are there in Seattle right now with you. This is a little bit of a different vein. This is more like about life and what it means for what we do. So first of all, I'm not there, so I can't see you guys, but I'm imagining that there are a good number of millennials in the group. And so this is like a trigger warning. You guys know what that is? Which is that I'm going to say some things that, might bother some folks, and that's okay. If it gets you to think differently and improve yourself or your life, then it's probably worth it. So, I always think about us as neurological surgeons, certainly, and orthopedic spine surgeons would fit that bill as well, as being like the apex predators. So ordinarily, I'd ask you guys what you think of these individual mammalian and one reptilian type of animal, and those are the big six, right? If you're a hunter, you know that these are the big six African game items or animals that you are trying to kill if you're a trophy hunter. But we are like that. We are like the apex predator, which is important because you think about what we mean inside of an environment like medicine. And I think also about being a neurosurgeon, I think about it this way, and I think to get to some degree, the ortho spine guys are like this, which is the founders of our specialty, such as Harvey Cushing, and Lars Lexell, right? And Victor Horsley, they're like the early explorers, whether it be Neil Armstrong or Jacques Cousteau or Sir Edmund Hillary. So what do I mean by the 7 ages? So the root of this comes from Shakespeare, which is from a short play that many people have not heard of called As You Like It. And it talks about the 7 ages of a man, and it could be a woman too, right? So 7 ages of a human, and here they are inside this poem, which is the infant, the schoolboy, the lover, the soldier, the justice, the pantaloon, and then second childishness, right? So this really comes from many, many centuries ago in terms of this concept, right? And why am I talking about this? Because in order to navigate the world, it really helps to understand who you are as a person. Who are you, the person sitting in that chair? Who are you and what do you represent? So a couple disclaimers. First of all, age, as defined in this talk, it's not purely chronological. Okay, it's not just about how old you are in terms of years. It's also not just a state of mind. We see a lot of people who say, well, I'm 80, but I feel like I'm 20. It's not exclusively up to you, right? It is partly under your control, but it's also dictated by things like your biology, right? So lots of folks look and they think of themselves in a very distorted way, and it can happen in both directions, right? So that's important to understand. Now, couple other disclaimers. I have not passed through all the ages. There's some people in your room that are a little bit older than me. I also do not claim to have done this properly or well, but a lot of what I am talking about comes from not only mine, but also my mentors' personal experiences. And it comes from listening and watching neurosurgeons and orthopedic surgeons of all different ages. Now, this is actually a great paper. This is from Alan Friedman, who used to run Duke University's neurosurgery program. He was a brain tumor surgeon, and he wrote this fantastic paper, and it published in 2008, I believe. And it's great because it talks about different generations and how that affects training of surgeons. And he has this amazing table here, and I apologize if you can't read this all, but you should look at this paper from the Red Journal of Neurosurgery. And it talks about these 4 groups, which are the veterans, the baby boomers, the Gen Xers, and the Nexters, or millennials, right? They later became known as millennials. And now we have yet a younger generation below the millennials, right? Which could be called coronials or Gen Z or whatever they call them now, right? And the great thing about this table is it has a 4x4 table down here of what each group says and thinks about the other groups, the other 3 groups, right? And it's really fun to actually think about this. Like the veterans think that baby boomers are self-absorbed. The Nexters say that Gen Xers like me need to cheer up more. It's really fascinating when you read it. Now, I've chosen to use an allegory for this, which is going to be Star Wars. And I'm kind of a geeky Asian guy, so I like Star Wars. But, Star Wars is really the American epic opera, right? It's easy for people to relate to. The characters are identifiable and realistic, even though they live in a futuristic space world. And it's gone through several iterations, so it's quite interesting. And I had the pleasure of meeting George Lucas before when I was a young attending from a meeting at the Congress of Neurosurgeons. So everybody has a personal journey, right? So these are stereotypes. They're not nothing other than generalizations, and nothing that I'm saying is intended to be ageist. And remember that some people are neotenized. What that means is that they get frozen in an age. And it's quite interesting because you may know people like this. They're frozen in place at one of the 7 stages, right? So these are the ages. There's the infant, the child, the adolescent, the young man, the middle-aged man, the career twilight, and then retirement. Okay, now, why talk about this? It sounds ridiculous, right? You guys want to put in screws and cages and artificial discs and all that. Well, number one, it could be entertaining, right? Which is a requirement for the Seattle Science Foundation. Maybe it's going to make you think about what you're doing today and the future and the past. Maybe it will get you talking to each other about this important topic, and allow for introspection to think about who you are, maybe even prepare a little bit of yourself or your life and your family, and maybe lead to meaningful change in terms of your life and whatnot. So the infant. So if we were to use the Star Wars analogy, if you will, this is like the young Anakin Skywalker. For those of you who are listening, I know SSF has a big following on social media. If you're in high school or college, this would be like the corollary of the age, right? And there are milestones in this age, which is like establishing a general base of knowledge, learning work and discipline, developing morality and ethics, and sort of finding yourself, right? And the infant has a lot of positive traits, right? First of all, limitless potential, right? That's amazing, right? When you're young, complete freedom to explore and forgiveness for your mistakes, right? But there's some really big negatives. Number one, you could be aimless. There's intense peer competition. If you're trying to get into spine surgery, you got to get in medical school and in residency and in fellowship, and then you're in attending, and even that's not the end. And then the actions and mistakes that you make at this stage have major repercussions, like a pebble hitting the water, right? The ripple effect, that little things that happen to you now, like let's say you get addicted to drugs. Let's say you have a felony on your criminal record, right? Things like that have major implications that will follow you for the rest of your life. And I like to quote out of this book. It's a very short treatise if you want to read it. Admiral William McRaven, who organized the Bin Laden kill operation, Zero Dark 30, memorialized it in film, and wrote this nice book called Make Your Bed. And what he says is you start by making your bed. This is required of Navy SEALs and, of course, everybody in the military. So get up in the morning, make your damn bed, because if you do that, you've accomplished something in the day before you even get going, right? So it's an interesting concept in terms of how military leaders try to train their people. Now, next stage, I'm going to call this the child, right? The child is kind of like when you're in medical school, right? So the milestones at this stage, this is going to be like the sort of the young Anakin Skywalker coming up and getting his midichloridian count ascertained and following his apprenticeship. So you're learning the vocabulary, you're developing interpersonal skills, you're getting real certifications like an MD degree, and you're trying to be sure of spine surgery, neurosurgery, orthopedic surgery, all those things that you're trying to do. And the child has some really positive traits, right? Number one, you're getting security with your peers. You're in the school, you're in the medical school, you're in the club, right? You're already on your track. Everybody's so proud of you. You're going to be a doctor, right? All this stuff, right? You can have accomplishments without any responsibility, right? You can start to rack up some accolades, and yet you're not really accountable for things like the papers you write or the patients that you trash or anything like that. You don't really have to hold the end result of that, but you can get the accolade. That's a huge advantage. And you can still change career paths. You can still try to figure stuff out. You're not locked in. You're not wedded to anything. But there's some major pitfalls too. Like you're still financially very dependent. You could be wasting your time very easily, which is valuable. And there's often a lot of uncertainty in terms of direction and a lot of conflicting viewpoints. Like if you're in medical school, people are like, you should do this, you should do that, you should go into ortho versus, urology or medicine. And so there's a lot of people trying to win you over, but that leads to a lot of meandering as well. And when I think about neurosurgeons, right, and I'm a neurosurgeon, I'm a neurospine surgeon, I think about it in this regard. This is a slide from a paper in Annals of Internal Medicine that Bob Harbaugh shared with me. And this is fascinating because it shows on the XY axis this concept of work-life balance. So the Y-axis is satisfaction with work-life balance, and the X-axis is burnout. Okay, so as you would expect, almost all scenarios of living involve lower work-life balance or poor work-life balance being associated with high burnout, and good work-life balance being associated with less burnout. That makes sense, right? Except for us, except for people like Rod or Charlie, right? For us, work-life balance doesn't exist in the normal realm. So if you look at the outlier field, it is here neurosurgery. It could be orthopedic spine surgery, but orthopedics is mostly not spine surgery, right? So you see everybody else falls on that line if you have a great work-life balance, like in occupational health and medicine, you have low burnout, right? But if you have a very stressful job, like in emergency medicine or some of the surgical fields, you tend to burn out more, except for in spine or neurosurgery. Now, the next stage is adolescence, right? So this is like young Luke Skywalker. He's here. He's like the resident, and his attending, his mentors, Yoda. You feel like you're carrying Yoda around, right? You're carrying, oh my God, these attendings, all they do is abuse us. We're on call all night. They don't understand. They never went through residency, right? It's all BS, right? Of course we went through it, right? Here, Yoda is trying to teach young Luke what it takes to become a Jedi Master, right? And so the milestones, of course, learning the craft and art of spine surgery, getting your first kind of a real job, you're actually being paid for it, working out these kinks, and then you're going through your major life events, like maybe getting married, maybe having kids, maybe nowadays for millennials, it's like getting a dog, right? Stuff like that. You're actually doing things that are not completely childish. You're making milestones. So there's a lot of super positive traits. Number one, you're finally on a defined trajectory. Most people who start residency will finish it. There's minimal attrition. You get authority. Now you're finally in a position of control, and you have a lot of purpose. It's very obvious what you need to do. Get up early, round on the patients, do the scut list, show up for surgery, don't fuck it up, right? But there's pitfalls too, right? Obviously, the tremendous workload. It's a hierarchical system that's fairly rigid. You have a lot of responsibility without independence. You're delaying your life. If you have friends in law school or business, they've eclipsed you already, right? And not really understanding the value of your training, which is why you're here in Seattle, right? You're trying to figure that out. Then there's the young man. Okay, the young man is the assistant professor or in their first job. So this is a time that's very interesting. It's like the young Obi-Wan, right? You're establishing independence. You're trying to get board certified. You're dealing with your own complications. You're struggling through all this. This is the most tumultuous time usually in the lifetime of a surgeon. And the positives, of course, financial rewards. Suddenly your salary goes up tenfold from being a resident. You get to decide, what am I going to do? Where am I going to live? What am I going to do? What cases I'm going to do? I can move wherever I want, in America anyways. And this is an amazing time in people's lives, but there are major pitfalls. This is the first time when you can fall off track, because up until now, everybody has told you what to do. Now you're expected to know what to do. And that explains the very high rate of turnover. So you probably all know that the average length of span for a neurosurgeon or orthopedic surgeon, right, in terms of their first job, 50% of people will change jobs within the first 2 years. So it's very interesting to me that we can go through training, work 120 hours a week, get paid. I was paid $30,000, $28,000 a year, live off of hospital food, right? Have no life for 7 years, and that's fine. I'm not going to quit. But then I get a job that pays $700,000. I have complete independence, and I'm done with it. I'm quitting, right? Why is that happening in people's minds, right? This is very interesting. And it has to do with a lot of factors, like having self-doubt, needing certainty when you can't have it, and expectations of your family, like your spouse, right, that are pretty unreasonable. So for these last two stages of life, this is a very interesting time, because we encounter a phenomenon that happens psychologically with people in surgical fields, right? The first is overconfidence while you're under the protection of others. And the second is sort of a deflation or compensatory psychological effect, which is I need to prove that I'm this person, even though I know I'm not that person. It leads to like an imposter syndrome, right? And so many of you are probably familiar with the concept of the Dunning-Kruger effect. This was coined after this case of two bank robbers in Pittsburgh who showed up at a bank to rob the bank, and they put invisible ink, like the stuff kids use, like vinegar, on their face. And then they showed up to rob the bank. And when they were arrested, because obviously they're caught on camera, like, well, how did you see us? We were invisible, right? Well, you're an idiot, right? You're a complete idiot. They didn't think they were. And the Dunning-Kruger effect is this. It's that as you get a little bit of experience, yeah, I've done 3 microdiscectomies. You're like, I know it all now. Yeah, get out of my way. I'm the master, right? And that's a very important source of pitfalls within this age group. And so Donald Rumsfeld, I think he died last month. He states this very famous saying, which is there are known knowns. These are the things that we know. There are known unknowns. That is to say, things we know we don't know. But there's also unknown unknowns. The things we don't know. They're like blind spots, right? So then we move on to the next stage, which is the middle-aged man. This is like an associate professor, mid-career person, right? This is where most of your mentors or people that you idolize lie, because these people are like the fully realized Obi-Wan who has killed 4 Siths, right? He is unstoppable. He's young enough to be physically vigorous, but yet old enough to have wisdom, right? So here you develop surgical proficiency, you're polishing your career, you've got your greatest economic potential, your nuclear family is, realized or started, so you have stability, hopefully there. And of course, the pinnacle of your career is achieved, right? And you have unquestioned authority. Most spine surgeons have unquestioned authority when you're at this stage, and minimal physical deterioration. You feel like, you feel pretty strong. But there's super pitfalls here again. Hubris, boredom, which often leads to divorce or malpractice or drug use. Missteps here have a lot of impacts as well. And maybe the biggest mistake here is thinking this is going to go on forever. This is the most common mistake I see, which is you're at your prime. It's like, yeah, I'm going to be like this forever, right? I'm not going to get cancer. I'm not going to break my arms. I'm not going to get carpal tunnel syndrome. I'm not going to get slower or lose my vision. And the reality is not like that at all. And you think about Harvey Cushing in this stage. Harvey Cushing, of course, founder of American neurosurgery. And this is 100 years ago, okay? Think about how hard it was to do this, right? He published 6 books and almost 100 papers. This is not like now where you get on a computer and 20 authors on one paper. These are real papers, right? When he was analyzed, it was analyzed that he actually was writing about 10,000 words per day. Can you imagine that? If you were to go back and say, have you written 10,000 words like in the medical literature today, right? Every day, right? And of course, he was doing a tremendous amount of surgery in a time when nobody really understood it and it was very scary. The 6th stage is the career twilight. This is an interesting point. This is like the full professor, leader of the group. Some of those guys are there with you today in Seattle, right? These people are like the aged Obi-Wan. They have a lot of wisdom, authority, presence, but yet biologically they're starting to fail, right? So the positive traits, balance, you understand pressure, you understand that you can control almost any situation. You have free time to start to explore things like sailing or other hobbies. And if you haven't done right by your family, a lot of surgeons take a second chance, meaning a second spouse, right? And they try to restart their lives. This is a very interesting phenomenon. There's also pitfalls. There's often economic uncertainty because your productivity is reduced, okay? There's physical deterioration and obsolescence. You start to lose your peers to death. Okay, and you try to replay your life choices, right? And so this is from Michael DeBakey, the great Michael DeBakey, maybe the most famous surgeon in America, American history. Michael DeBakey founded the VA system. If you didn't know that, the veteran system of America of healthcare was founded by Michael DeBakey. And he states, I would not mind being operated on by a surgeon of 91 when he was 91 years old, right? So it's very interesting, Michael DeBakey, and of course he's passed away. And the last stage, of course, is retirement and senescence. This is like the retired or emeritus professor, right? And this is the close of the career. This is like the old Luke Skywalker, right? The family is now like an extension of you, and you're dealing with your mortality, right? Because it's coming. So the positive traits are finally, after all of this work, you absolutely have some free time. Since the very, very first stage, you had no free time, and you don't have to struggle as much. You're hopefully at peace with who you are. But of course, and this is a big one, as you lose your identity as a master surgeon, you're not the same person. People don't look at you the same way. People pass you in the hallway of the hospital. They don't even know who the hell you are. And that's not easy to get used to, from what I understand. You also deteriorate and you lose your loved ones, right? So these are important pitfalls, right? And so when you think about things like satisfaction in your career, and this is a great paper by Paul Climo looking at this in terms of US neurosurgeons and burnout, right? Thinking about what are the things that make you burn out, and it's not usually what you as young people think. It's usually not your salary and stuff like that. It's all these other pieces. It's not time off either. It's usually self-actualization, right? Personal growth, career growth, right? And so, the CNS looked at this in terms of this special issue looking at second acts, like here's Steve Hune, who's a neurosurgeon who started biotech at Stanford. Ruth Kerr-Jacoby went back to law school and became an activist. Catherine Coe is an artist, and Joe Maroon, who some of you know was an entrepreneur and sells vitamins and stuff like that. So there's a chance to do other things that might be different, right? So in summary, Confucius said it best, right? By 3 methods, we may learn wisdom. The first is by reflection, which is noblest. Second, by imitation, which is easiest. And the third, by experience, which is bitterest. So I hope that in hearing this talk, it maybe cues you into some of the things that are coming, because we're all so busy doing surgery, taking care of patients, writing papers, and all those things. But this is really the big picture, the 40,000-foot view of what we do. And my answer is the key to what you're going to be is usually going to be the people you're around, like your spouse, right? And I think about my, Danny, whatever you need. And I think about my neurosurgery family and how intense my life is and how intense all of your mentors' lives are, and how we try to balance that with our careers, which is not about just leaving work so you can go do other stuff. It's about combining both together so you can get time shared between your hobbies and your work life, because life is super short. Before you know it, life is over. There's a great Luke Bryan song where he talks about where the days are long and the years are short. And that's the truth. Before you look at it and blink your eyes, you will be old. And how will you approach that and how you balance that? I'm not suggesting I have the answer to that. So thank you for your time. I apologize I cannot be in person there in Seattle, but this is a great course, and congratulations on your fellowships and your future careers.